Hi guys, it's Dee. So I planned to make that video immediately after my last one, but I did do a few things in between, such as set up my Christmas tree. It's very cute. It's smaller than it looks on video, but it's perfect for me, just one little tree. Anyways, I've got a very serious video to make for you guys right now, and I'm going to make a bold statement during this video that might just get me kicked off of YouTube, but it's serious and it's true and it needs to be said. So as you know, I'm a nurse. I've been a healthcare provider for 16 years. I have worked in emergency departments. I've worked in the community and with the police in a forensic capacity. I have a lot of experience, and I have a lot of experience with what I'm about to talk about with patients and clients and those I've worked with, and I've seen good outcomes and positive ones, and I've seen some really sad and tragic outcomes as well. And this is some serious advice and some information. So if you fit in this category, there is no shame, and it's something to just ponder and think about and consider. So we are coming into the new year, and a lot of people are going to make New Year's resolutions. A lot of people are also going to do that throughout the month of December, decide things they want to change. There's also a social culture right now on glowing up and improving yourself. I don't know if it's the same with men, but it's very predominant among women. Every time you get on social media, it's all about glowing up, being your best self, being your very best, like getting rid of, there's like this cliche lifestyle that women are encouraged to live, and it doesn't include any bad habits, any negative lifestyle choices or things or habits that we've become accustomed to, such as regular alcohol use, especially among women. If you didn't know, women are the largest majority population of people who overuse alcohol, and it's usually women. You would think that there's a binge drinking era in young women, but the consistent daily alcohol intake and daily drinking goes on with women in their late 20s to mid 40s, and it's like a wine culture thing, and it's very damaging and very dangerous, but it's made to be socially acceptable, and it's almost romanticized, being someone who drinks wine or enjoys wine every evening and this sort of thing, when really that can become something severely dangerous. But anyways, this video isn't just about that. It's about anyone who consumes more than a drink a day, a couple drinks a day for any period of time, or anyone who consumes any recreational or prescription drugs regularly or more than they need to. And this is how I'm going to help you, because I want to tell you, and this is a statement that might just get me kicked off YouTube, don't just quit. Don't just stop. You can't do that. So I'm going to start with alcohol, because it's the most predominant, it's the most common, and it affects a huge number of people who don't even think they have a problem. Women will have a glass of wine while they're making dinner, then one with dinner, then one while they're cleaning up after dinner, then maybe one while they have a bath, or one before they go to bed. And it's like this wine culture, and that is alcoholism. And it's romanticized to not look like that, but it absolutely is. But the problem is when you stop, it goes far beyond the shakes and some sweats and maybe diarrhea and inability to sleep. The side effects from stopping drinking alcohol can range from those mild symptoms, which are common and almost everyone's going to experience, to more serious symptoms that almost everybody can experience as well. And I have seen a ton. The majority of people who drink more than a drink or two a day, and just for any period of time and stop, are going to experience these symptoms. And these are, first of all, diarrhea is deadly. It's deadly dangerous. So you lose all your fluids. You can go into kidney failure and heart failure very quickly. It causes heart arrhythmia and tachycardia, which is a very fast heart rate, which can turn into a dangerous heart rhythm that can kill you. It also can cause strokes, this dangerous heart rhythm. So that can happen just from having severe diarrhea for any few days or a prolonged period of time. So diarrhea on its own is dangerous, but alcohol withdrawal can also cause seizures, which can absolutely kill you for the same reason, because Seizures can cause another heart arrhythmia that can turn deadly and kill you, and a fast heart as well that turns into that dangerous heart rhythm. You can also choke while you're having a seizure, and unfortunately it's the end, like you're done, you choke to death and you don't wake up from that seizure. I've seen this numerous times. I've seen numerous heart attacks from alcohol withdrawal, numerous seizures, many seizures from young women in their 20s to women in their 50s. Tons of seizures. Men have them too. I mean, men aren't excluded, 100%. Anybody who's drinking more than a drink a day for any prolonged period of time, it can be a couple months, sometimes even a couple weeks, unfortunately, if you're prone to these things. So you're looking at seizures, you're looking at dangerous diarrhea, like these are very serious side effects, and these are just from alcohol. And what I want to tell you is there's medication that stops these symptoms from happening and will stop your withdrawal, so you won't feel and crave alcohol, and you also won't have those dangerous side effects, and those are benzodiazepines. And doctors are very happy to give them out. If you go into any doctor, either in an emergency room or in the community, and tell them you have an issue with alcohol, and just tell them how much you've been drinking and for how long, and tell them how you're feeling, or say you saw this video and a registered nurse has said you need to see a doctor before you stop, they'll be glad to give you a medication, a benzodiazepine, that will completely stop the withdrawal, the instant cravings and the instant need for alcohol when you stop drinking. And it will also remove the risk of those side effects that can kill you and cause permanent brain damage as well. But worse off, can kill you. And it's very common. These side effects are common. They're not the minority and it could happen, that's not going to happen to me, I've stopped drinking before, I'll be fine. This is the majority of people who just stop cold turkey. They experience these severe side effects. So you go into a doctor, you tell them before you stop drinking, don't just stop. And you tell them your plan, and they need to know that you're committed to it, because if you drink while you take these medications, that too can be deadly. So you have to be committed to stop drinking alcohol, and you have to be able to convey that commitment to a doctor, and they might want to see you regularly, every couple days at first, to make sure you're not drinking, to make sure you're safe, and give you these meds a little bit at a time so that you're taking safe doses of it. But I'm telling you, it's going to make the pain of stopping drinking alcohol, it's going to eliminate it. It's going to make you feel like you don't need to drink. You're going to have that calm feeling that you have after you've had a few drinks. You'll feel that way already because of these medications, and you won't feel like you need to drink to achieve that. And it will eliminate your risk of dying. Now, drug addiction, either prescription or street drug addiction, first of all, you need to stop, but you can't just stop. It's like a double whammy. There's a fentanyl crisis right now, and it's on the street. And if you are addicted to prescription pain meds like oxycodone, Percocet, fentanyl, any of these medications, and you're overusing them, so you're buying them on the street, and you're buying them because your doctor's not going to prescribe you more. And what happens with these meds naturally is the longer you take them, the higher your body's tolerance becomes to them. So it's not addiction, it's dependence. It's different. Addiction is a mental health issue. Dependence is a whole different issue. It's because your body now is dependent on them, dependent on these meds to do things like to go to the bathroom, to be able to eat. You might not feel like you'll feel sick to your stomach, and you won't be able to eat if you don't take these medications, and you need to take them at higher and higher doses regularly if you've been using them for a prolonged period of time. And doctors know this. This is why they have significantly stopped prescribing them. It used to be that they prescribed these things constantly, T3s and Percocet, Oxys. They were the go-to for pain relief, and doctors are hesitant now because of this, because we really understand that our bodies do become resistant to it, tolerant of it, and dependent on it very quickly. And it's very quickly, within weeks, within days. You'll notice if you've had surgery and you're taking Percocet after, and you need it, and you should take it if it's been prescribed to you, because over the short term, this isn't going to happen. But You'll notice after 4 or 5 days that one Percocet that you were taking doesn't do anything for you anymore. It doesn't stop your pain. Now you need to take 2, and the bottle will say on it, take 1 to 2 every 4 to 6 hours. And all of a sudden you'll need that too, because your body becomes resistant very quickly, and the resistance turns into dependence. So if you're using these drugs and you think you need to go to the street to get more, get help first. Go to a doctor first, because on the street, all these drugs are filled with fentanyl, and fentanyl will kill you. It will absolutely kill you. I have to show you something. I think I have one here. I do. I have one here from work. If you are an opioid user, so either it be prescription drugs like Percocet, Oxys, Tylenol 3s, or it be street drugs like cocaine, heroin, crack, fentanyl, anything you're getting that is opioid based, so like codeine based medications, or codeine phosphate's another one that's prescribed. You should never ever be using these drugs, first of all, alone, because if you do overdose by accident, or you've taken too many because you're so tolerant to the dose that's prescribed to you that you need to take more to get that pain relieving effect, so you overdose by accident, or you buy recreationally and you get a dangerous drug that's mixed with fentanyl and you become unconscious and start seizing, because that's what happens from these side effects. This is what you need to have on you. They're naloxone kits. And what's inside of them is, I have these from work. You get 2 of them. There's instructions, very easy steps. And you pick these up at any pharmacy for free. And they will take your OHIP card for information, but this is private. No one will ever know you have this. And if you're using any of these drugs, either prescription for a real reason, or either out of addiction or dependence, or you're buying it on the street and using it recreationally, it doesn't matter. You need to have one of these kits. When you leave the hospital and you come home, on your way, stop at the pharmacy and pick up a naloxone kit, because if you take too much by accident, this will save your life. So all you do with these suckers, you get one, you just peel it off, you just peel it open, and this is a nasal spray. You can administer it to yourself if you start feeling sick really quickly. You only have a few minutes to do this. Or if it's fentanyl, you don't even have that. You won't have a chance to administer it to yourself, most likely. You're pretty much dead when you hit the ground. So you need somebody else to be there. Trip sitters, we used to call them. Somebody else to be in your home with you, that if you've responded badly, you've taken your meds and now you're seizing, you're frothing out your mouth and nose, you're choking, you're gagging, you're vomiting, you're unconscious, they can spray this up your nose and it will instantly, within 60 seconds, completely reverse 100% the side effect of that medication. You will wake up instantly. You will stop seizing instantly. If it doesn't work within 60 seconds, then you administer, or somebody administers, the second dose. And that second dose certainly will do it. Now, the other scenario is you administer the first dose and it works. You wake up, you're fine. You need to call 911 right away, because this wears off and you will go back into that state. This is a life-saving measure. And if the ambulance is taking longer than 5 minutes to get to you, 5-10 minutes later, you start feeling symptoms again, or you start demonstrating symptoms again, that person, that helper, that family member, or whoever happens to be around, they can administer then the second dose while you're waiting for ambulance. What else comes in this kit, as well as these simple instructions, which you don't need? You spray it in your nose, stick it up, spray it. It also comes a one-way mask, and in here is a mask that you just put over someone's mouth and you can give them artificial respiration, because that's how serious this is. This is what we're talking about, guys. You've got a few minutes before you stop breathing and you're dead. So that's what fentanyl does to you, and that's what happens when you buy drugs on the street, because you're overusing your prescription medication at home because you've become resistant and tolerant to it, and that isn't your fault. That is how a lot of recreational drug users get started. They start from a prescription after a surgery or back injuries, and all of a sudden it doesn't do it for them anymore. It doesn't stop their pain, and the doctor's not going to increase the frequency or the dosage of the medication, and they turn to the street to stop their pain. And that's how you end up in serious trouble, and you end up dead. So naloxone kits, number one. That's your number one step. So what you can also do is go to your physician first if you're misusing your medication, or you feel like your meds aren't working for you anymore, and that's because you become tolerant and resistant to it. And there's other ways to treat pain, and I know it's scary when the pain medicine you've been on has been effective. It's scary to think of trying other things. You think it's just not going to work, it's not as strong, it's not the same, it's baby medicine. There's other things that really do work, okay? And you got to go to the doctor first. And there are two medications. There is methadone and Suboxone, and those we will give you. Those medications will stop the feeling of withdrawal from your prescription or your street opioid drugs, and you will feel no withdrawal. You will feel no cravings. You will feel none of that, okay? And you'll be on it long term, because it's a long-term process. You'll start at a higher dose, a high dose, so you feel zero symptoms, and then slowly over time, the dose will get decreased till you're off it, and all of a sudden, there's no more dependence, no more addiction, and you don't need these meds anymore. And maybe they're substituted with something else that treats your pain even better, and you didn't even know existed. So you really got to keep good communication with your physician when you're being prescribed any medications for pain, especially if they're opioid medications. And that's what this video is about. And what I left out about alcohol is that first prescription that the doctor will give you, the benzodiazepine, to initially stop your withdrawal symptoms and stop the cravings for alcohol. Once that initial danger for seizures and heart arrhythmias and heart attacks ends, they will put you on a long, and you're sober at that point, and you didn't even realize you got there because you felt no pain because you've been taking the medication that the doctor prescribed. Then they'll put you on something called naltrexone, and naltrexone is something you'll take over the long term, and that will help prevent you from ever feeling the need to go back to drinking. It is a wonderful, wonderful drug for people who have become dependent or addicted, which again are two different things, on alcohol. And you'll take that naltrexone and you'll never feel the urge to drink. You just won't feel it. You won't feel it. And when it crosses your mind, you'll be like, should I have a drink? You'll be like, meh, I can do without it. And that's what naltrexone does for you. So there's a short-term treatment and a short-term cure, and then a long-term plan and a long-term cure. So don't ever be scared to go to the doctor, have this open communication about alcohol use or misuse, and really get some help. Don't just stop, because it can kill you. And back to the drug use again, guys. If you're gonna use and continue to use, that's your decision. I always advise everyone to just stop, live your best life, feel better, just stop, because it weighs on you. It makes you feel guilty, even if you don't realize it, and it's like a burden on you knowing that you're stuck on this, and you don't need that. You're too good for it. You don't deserve it. And you don't get there on purpose. You get there by accident, and everybody's the same. Nobody gets there. Nobody sits around the circle when they're 5 and says, when I grow up, I want to be a drug addict, or I want to be dependent on oxycodone, or I want to be an alcoholic. If you are addicted to alcohol or to drugs, if you're addicted to any opioid drugs, have one of these suckers. Pick it up for free at your pharmacy. Give your information, your OHIP card, and get it. It's not shared. Nobody can get it. No one can get that information. No one can get the information from your doctor about any alcohol use. Not your employer, not your family, not anybody. Even if someone came with a warrant, then that doctor and those pharmacies' lawyers are going to fight that first. So nobody's getting your information, and no one's going to know about your health issue. It is so private. So you are safe. Please go to your doctor. If you're using drugs and you're using opioids and you want to stop and you're ready to stop and you're done, get on methadone or Suboxone. There's no reason not to. There are doctors everywhere. Look for a clinic. You can find me at D_Beth. And yeah, it's DEE_BETH on my Instagram. DM me, and if you can't find an addictions clinic near you, I will find one near you for you, where you can find a doctor that prescribes methadone and Suboxone. But there's also, across North America, we have something called, especially in Ontario, I know for sure, we have something called RAM clinics, and RAM clinics do it. Pharmacies have methadone programs. You can go into Shoppers Drug Mart or any other pharmacies and ask if they have a methadone program or a Suboxone program. If they don't, they will tell you who does, and you can go and they'll get you started on this so you can stop taking these opioid drugs without the risk of dying, because you can't just stop on your own. It's deadly. It's worth your life. But you do need to stop, because continuing is also worth your life, but you need to stop properly and with medical help. So with that, my friends, I'm going to end this video. So happy holidays and happy New Year's resolutions. And I hope if you do have a problem with any of these issues, you make that your New Year's resolution. But start it early. Start it in December. Go to a doctor first of all and make the plan and get started on it. So by January, maybe you're sober and your New Year's resolution is already kicked in, because you're doing it properly and you're doing it safely and you're doing it with the doctor's help and without physical pain, without the feeling of withdrawal, without cravings, without losing days from work from being sick with diarrhea and vomiting and shaking and sweating and seizing and heart attacks. And you can continue going to work, you can continue going to school, you can continue being a mom and taking care of your kids and being a wife and a husband and a daughter and a sister and a brother, and nobody will ever know you're going through anything, because these medications will stop any symptoms and stop the cravings. You'll still feel social, you'll still feel like yourself, you'll still feel engaged as long as you're on these meds. So guys, don't hesitate, get the help you need and feel better. That's all. And live a longer, healthy life. Do it safely. And with that, I will see you guys soon. Have a great evening.